This is a University of Otago podcast.
Hello, I'm Dr. Rebbecca Lilley from the Injury Prevention Research Unit, and I've been asked today to give you a presentation on the work environment and health, in particular to give you an overview of how we control workplace hazards. So in this overview we're going to cover the importance of the workplace, the burden of occupational injury and disease, the types of workplace hazards that are experienced, how can we go about identifying those hazards and preventing and controlling them in that workplace setting, and the different managerial approaches to this control. And then finally I'm going to talk about an example of agriculture in which we have great difficulties with in New Zealand in terms of controlling workplace hazards in that setting. So first up, I'm just going to present this slide which shows the pathways of influence of work on health and the environment, and it shows that those pathways can be quite varied and they can be direct or indirect. When we look at this pathway, if we look at work versus influencing, having a direct impact on workers and workers' health, as you can see at that end of the diagram, it has an ongoing and indirect influence on the recreational environment and on the home environment, as well as having a direct relationship with exposure to workmates. Something that we could think of here, an example we could think of, is maybe a farmer who comes home with spray-covered overalls. They've obviously got covered in spray during the process of spraying, so maybe some crops or something. If they bring their overalls into the home environment and just chuck them into the washing machine without separating them out from the rest of the family washing, there is the potential that the family's clothes can get contaminated with those sprays and the rest of the family can get exposed to those workplace exposures through that route. As well, in the workplace, workmates can get exposed when they come into communal areas, communal eating areas and such like. In terms of the work-to-worker interaction with recreational environments, there was an unfortunate incident that's a really good example just recently where a council worker was mowing a recreational area and unfortunately a small child got caught up in the mowers and was killed. So that's a really good example of how there can be this worker interaction with the recreational environment. An example of the interaction between work, the internal and external environment, worker and workmates. Really good examples of this are things such as noise. Whereas the work process generates noise that can affect the worker, it can affect the surrounding workmates, it can also contaminate the internal environment, and it also can spill out into the external environment and contaminate the external environment. Fumes, so fumes from solvents are also another really good example of where we can get this much broader contamination into the broader environment, and it can have an impact on communities and the general environment. So work can have direct impacts upon workers' individual health and well-being, and indirect impacts upon the health of the communities and the broader general environment. So there's a real need to protect both workers and the environment. Therefore, there's quite significant overlap in the management of occupational health and safety and of the environment in its broadest sense. So controlling hazards for workers is really the first step in controlling broader environmental concerns that are generated by work processes. So the work environment is quite a significant environment. 1/3 of adult life is spent engaged in work processes, so it's a significant amount of time over a person's life course, and by a life course I mean from birth to death. It's a significant chunk of that life course in which a person is actually exposed to hazards in a workplace setting. We have significant numbers of people that are in the labour force, so we have big numbers of people who are potentially exposed to hazards that have potential to do damage to their health. In general, work is really considered to be quite beneficial for people's health. Work gives us the means through income to be able to actually purchase better health. The more income we earn, the more likely we are to be able to afford better quality food, better quality housing, more energy and the likes, and we can actually improve our health. Also, there's significant physical benefits and mental health benefits from the social interactions that we get in our workplaces. But unfortunately, at times there can be quite adverse work environments that can have quite significant impacts on people's health. So we can get minor injuries or illnesses, quite serious illnesses and injuries, disabling illnesses and injuries, and fatal injuries. Fatal injuries obviously being the most extreme outcome. And these can reduce a person's worker's well-being, their work capacity, so they may actually have sufficient impairment on their health that they may not be able to work for as long as they would like to. Significant impacts on quality of life while working, and then again later in the life course down into retirement, and they can also result in significant reductions in lifespan. Therefore, a focus on health and safety in the workplace is essential for ensuring that people are not harmed at work and that pain and suffering and loss are avoided, and ensuring that people are not injured such that we can extend the productive working lives of our citizens and contribute to economic growth and prosperity. So there is this broader social element at play here. The benefits of promoting occupational health and safety include enabling people to lead happier and longer lives, enhancing economic activity, reducing the demand on our health and social services, and reducing the costs of injury and illness on individuals and for our communities. So next up, I just want to talk about the burden of work-related injury and illness within our community in New Zealand. I've got some figures up here. These are quite dated figures, as you can see. They're from 2004, but they are the most rigorous figures that we actually have in this area. Unfortunately, when it comes to counting the burden in terms of the number of fatalities and the number of serious injuries and illnesses that there are in our community, we don't do a very good job at that for a number of reasons. It's really difficult to capture disease because a lot of occupational diseases have a really long latency period. So an exposure may have occurred maybe 20 years before an outcome actually occurs, and making that link between the exposure and the outcome can be very difficult when we don't have records on people's occupational histories, for example, and the sorts of exposures that they might have had in a certain workplace. So these figures can be quite variable and they're not particularly accurate, but these are the most accurate and robust estimates that we have at the moment. So it's estimated about 700 to 1,000 disease deaths occur per year, predominantly occupational cancers due to solvent exposures, for example, other chemical exposures, ischemic heart disease from the likes of stress and chemical exposures, and respiratory disease from dust exposure from chemical exposures and the like. And then we have about 100 injury deaths per year, and this is purely just of workers. We're not considering bystanders or any other groups that may be injured or killed in a work context. We estimate about 100 of these injury deaths per year, of which the majority are traffic-related deaths. So people who are driving heavy traffic vehicles, for example, trucks and the like, people who are actually driving vehicles as part of their work, so salespeople and the like that. So it's about 40% of those injuries are traffic-related deaths. And other work has found about 9% of our male deaths in our society are due to work. So it's quite a significant source of death in our society. In terms of new disease, it's estimated at about 17 to 20,000 new cases of disease every year, and about 200,000 new injury claims are lodged with ACC every year. The estimated costs, when we build in the broader societal costs, is about 4.9 billion per year, and there's some varying estimates on this, but this is a particularly robust analysis here done in 2006. The majority of these costs are borne by the employee and by society, with very minimal contribution coming from the employer themselves, even though the employer and the work processes undertaken actually cause the disease. Okay, so just some updated figures in terms of the state of health and safety in New Zealand. It's only really possible to get updated figures for injury, and these are quite poorly monitored and they can vary a little bit, but the best estimates we've got go back to 2012. We have a significant lag in terms of getting these figures from government agencies, but it's about 102 work-related deaths and 378 really significant, serious, non-fatal injuries. So they're injuries that hospitalisation has occurred and a person has had at least 5 days or more in hospital. And those social and economic costs of that injury is about 3.5 billion. So really significant burden and really significant cost on our economy. A lot of that cost comes from lost productivity and those broader societal costs. So the main types of occupational disease and injury in New Zealand in terms of disease, predominantly musculoskeletal injuries and disorders, especially low back pain. Noise-induced hearing loss is really prevalent and becoming increasingly prevalent because we have a lot of ageing workers who have been exposed to high levels of noise throughout their working lives. A lot of skin conditions and dermatitis conditions from wet work and various contacts with irritants. Occupational asthma and other respiratory conditions, and mental illness. Although mental illness was pretty poorly considered in the 2004 work, we definitely know that mental health conditions caused by quite stressful workplaces are on the rise and quite prevalent. In terms of injury, our main causes here are traffic-related injuries and fall-related injuries, as well as injuries that come from crushes. The serious work-related injuries, we predominantly see fractures and burns, internal injuries and traumatic brain injuries, so quite serious and severe injuries which have longer-term implications for people's health and disability. Okay, so I'm not going to labour the point here, but when we compare ourselves internationally, we find that New Zealand performs quite poorly with countries that we like to compare ourselves to. Much of that difference is reflected in terms of the different proportions of workers that we have in different industries. So, for example, we have a large chunk of our workforce sit within the agriculture industry, and when we compare ourselves to other countries, they don't have the same distribution. But once you account for those differences, there still are differences in terms of work-related fatal injury rates, and this is the only thing we can do a comparison on because we can actually get some relatively robust and comparable figures between these countries. And we do tend to still have quite poor work-related fatal injury rate when we are actually sure that we're comparing apples with apples and we start to adjust for some of the distribution differences in terms of where these industries are. These are, again, quite old figures. There have been updates to this that I myself have done for government agencies, but this is the most robust comparison that there is out there because we've actually harmonised the data in this particular comparison. So New Zealand could definitely improve its performance in terms of preventing occupational injury and disease. So let's move on to talking about workplaces and the types of hazards that are within these workplaces. So the key point here is, across these slides, that I want you to take is that workplaces are not all the same and the hazards present are quite different, and the types of health implications and injury and disease outcomes can be quite different depending on the range of hazards that are actually present. So the questions I'm going to ask of each slide is what hazards are present and what are the possible disease or injury outcomes that are possible due to those hazards. In this particular scenario, we have an office worker working on a computer, which is a very common scenario given that we're moving towards more of a knowledge economy. The hazards present here are the visual display unit with the potential for eye strain, Musculoskeletal hazards, so we've got repetitive movements, a static posture, long period sitting, so there's the potential here for muscular disorders and pain. And there's the possibility here that we could have quite high job demands. We see there's a few piles of papers stacked up. So we may have high job demands here, we may have low job control, which would suggest to us that there's a bit of psychosocial strain here. So there's a potential for all sorts of stress-related disorders. What hazards are present in this scenario? Well, this is quite a different scenario. We've got an outdoor environment, so there's always that added complication of the weather. We know in these types of environments that vehicles function quite differently on wet, slippery surfaces versus a dry surface. We have rolling terrain here, so we've got a risk of vehicle rollover and traumatic injuries. I guess another possibility here is dog bites, and certainly dog bites can be quite common, and there's the potential for infectious disease here. So there's a few hazards present in this scenario. Here we have a gas fitter. So hazards here, we have our bright welding light with the potential for eye injuries. We have welding fumes. If you look really closely, you can see just a few sort of hazy marks above the light there, which indicates there's fumes coming off this reaction. And there's certainly conditions such as welder's lungs, where we get respiratory conditions from exposure to fumes as a byproduct of the welding process. And also there is this really intense heat, so there's the potential for burns. Here we have some shearers in a shearing shed. The hazards that are present, we have significant musculoskeletal hazards. Here we've got repetitive movements and unsupported bending. So there's the potential for musculoskeletal disorders, particularly lower back pain and other musculoskeletal pains. We have animals in this scenario. Animals can be very unpredictable, so there is risk of injury from kicks and from head-butting of the sheep, which is quite common. We also have potential for infectious diseases and skin conditions from the lanolin, from the wool, and from other infectious biological hazards that can be passed on to the human. So there's a potential for zoonotic diseases to pass here. There's also potential for a lot of the wool can contain debris, and that can pierce the skin, so there's potential for minor lacerations and that sort of thing as well. Okay, in this scenario we've got some manufacturing workers in the food manufacturing industry. The hazards that are present are musculoskeletal hazards, so we've got a lot of repetitive movements, a lot of standing and heavy lifting, so again musculoskeletal disorders and pain are potential here. We've got high job demands and potentially low job control. If you can see all the fish that are backed up here, this is an automated process, so there is the potential for stress related disorders here. As you can see, there's some wet work, so there's the potential for dermatitis and other skin conditions. It's likely to be quite a noisy environment. The man there is pushing fish through a grinder, so there's the potential there for noise and hearing loss. We also have biological material in this scenario, so again there's a risk of infection. And with the moving parts of the grinder, there's also risk of traumatic injury in this scenario. Okay, so the key point here is that it's really dependent on the work process, the workplace and the worker, what type of hazards are at play in a particular workplace. But we can group our hazards into two main groups. We have our physical hazards and we have our psychosocial hazards. So our physical hazards result in physical illnesses, symptoms or injuries, and physical hazards can include physical elements such as noise, extremes of hot and cold temperature, radiation. Chemical hazards and dust hazards, things like corrosive chemicals, solvents, asbestos fibres, dust. Ergonomic hazards, things like repetitive work, heavy lifting, using force, having to maintain static postures and maintain holding weight unsupported. Biological hazards, things such as the biological agent for leptospirosis, viral hepatitis and HIV. So there's a whole range of physical hazards here that are potentially exist within workplaces. Then there's our psychosocial and organisational hazards, and these mainly result in injury and psychiatric illness and psychosomatic symptoms. So sometimes they can be more along that mental health extreme. And they include things like stressors such as high job demands and low control or low rewards, job stress, things like job security, things like perceived job security, so someone's perception of whether or not their work is secure, and then structural job security. So this occurs when a workplace is undergoing a restructuring of its organisational layout and design, and there may be some layoffs potentially about to occur. Then we have working time arrangements, things like shift work, night shifts, day shifts, rotating shifts, all have an impact on workers' health. Long work days and night work all have impacts on worker health. Other psychosocial hazards include things such as workplace violence or the threat of violence in a workplace, bullying and job satisfaction. So they can be quite varied. In this slide we've got a table comparing our physical versus our psychosocial hazards. Our physical hazards are very much context specific, so that makes them quite easy to control. If you can figure out the context in which the physical hazard is generated, you can control it more easily. They have an immediate impact, so they have an immediate impact on people's health, and we can measure that. There's a harmful level of exposure, so we can measure at what level exposure we can get harmful impacts. So the negative effect of these exposures occurs at a specific exposure level. Once we know that exposure level, then you can work at trying to reduce the exposure in your workers and your work site. Psychosocial hazards are very different. All workplaces, all contexts, there is the potential for psychosocial hazards. Chronic exposure tends to be quite hazardous to people's health, so it's long-term, maybe low-frequency exposures. It's not possible to determine if there's a harmful level of exposure. There can be positive or negative effects. It really depends on the person. A really high stress, high demand, low control workplace may be fine for one person, but someone else's perception of that may mean that it's actually quite harmful to another person's health. So it makes it really difficult to actually identify, measure and control psychosocial hazards. Okay, so how do we go about preventing adverse occupational health and safety effects in the workplace? The first step is to identify our hazards. And the strategies to identify the hazards in the workplace are varied. Various strategies that people use are safety inspections and audits, where you may have a checklist of known hazards and you run through that checklist and see whether or not those hazards are present in a workplace at the time of inspection or the time of audit. Some downsides to that is you might not pick up more temporal hazards that are only there momentarily during a work process or a work practice. And if your hazard's not on the checklist, it does tend to fall off and not be considered. You can observe workers, and this can be quite a handy way of trying to identify hazards. But again, it's quite difficult to identify psychosocial hazards there. You can use a job hazard analysis approach where you map out a particular job and all the hazards that are around it. And that can be quite handy for identifying job-specific hazards, but less handy for identifying more broader contributing hazards and maybe broader hazards in the broader environment. Another really common approach is to do incident or accident analysis, so learning from existing events or near-miss events. So I'm just going to talk a little bit more about investigating individual incidents and the potential that that has for hazard identification. In terms of occupational injuries, we want to do an analysis of individual accidents or individual injury events. So you want to look at pooling together individual events and looking at where and which type of injuries are occurring with an event. You want to monitor the development and the incident. So this is where you take that broader view across a workplace and look at the different types of injuries that have been occurring over time and occurring maybe within the past year, and looking at the incidence of the types of injuries and where they're occurring. So you're looking for some patterns. You want to look at those patterns because you want to look at the frequency and the severity. So obviously if you've got you're getting really frequently high severity injuries, you obviously want to prioritise your initiatives to addressing those injuries. If you've got really frequent low severity injuries but maybe one high severity injury, you need to balance that up. Where can you make the biggest impact if you've got say a limited budget? So you want to look at the different patterns of injury to establish those direct and underlying causes, and using a model of causation can help direct how you look at inquiring into different causes of injury. And here we have the model of accident causation. It's just one model, and in this particular model what I like about it is it includes a lot of human factors. So it thinks about the different ways that human interactions with a work process could actually be influencing the work process, the injury event, as well as thinking about more broader engineering controls, and we'll go into that in a few slides. But the use of a model can help inform which factors we should focus on with interventions to reduce the likelihood of another similar occurrence of injury occurring. By investigating such factors, the root causes of the injury can be isolated and necessary steps taken to prevent that injury in the future. In this model, the root causes are grouped as immediate causes and as contributing causes. The immediate causes focus on unsafe acts and conditions immediately prior to the injury, while those contributing causes focus on on safety management, performance, and the mental and physical condition of the worker as also possible contributors to the injury. The key here is that this model looks beyond just the person for possible points to intervene and prevent future injuries, and thinks about the pathway in which an injury event can occur. Okay, in terms of occupational disease investigations, a little bit more difficult because in general the exposure may have occurred 10, 20, 30 years previous, so you need to make that connection with an exposure a longer period in terms of there's a significant lag there. So in terms of the occupational disease investigation, we generally encourage people to take an occupational history. So the sorts of questions you'll be asking here is, what is your occupation? You'll be asking about the time sequence of events. Did the symptoms go away when you were away from work or when you took significant holidays from work, to try and tie it directly to a workplace exposure? Think about the early symptoms. The early symptoms can often be quite non-specific. So the example I've got here, metal fume fever, it resembles a flu-like fever. It has chills, headaches, nausea, thirst, cough and myalgia. So you will be wanting to ask about some of these early symptoms earlier on, and when a person recognised that they were having these types of symptoms. The other thing that's really key with an occupational history is getting a work and exposure history. So you want to look at the current job, you want to look at previous jobs, you want to look at dates, the different types of industries and occupations a person has been in, whether or not they used any personal protective equipment, any exposures or hazards that are thought to be contributing to those health problems, and whether or not there are any other affected employees. So it's much more of a historical investigation in terms of looking at occupational disease disorders and disorders. Other things we want to consider here are other exposures, so other passive exposures that may be occurring in the workplace. So it may not actually be something that a person is directly working with, but the fact that somebody close to them was doing a work process that was contaminating the working environment. Other hobbies and second jobs or moonlighting, whether or not they have been adding to their exposure by these activities, and the role of community environmental exposures as well. This is particularly important with lead exposure, for example. You can get exposed to lead in the community as well. So the second step here in terms of controlling these hazards, well, the second step, sorry, is actually controlling hazards, and we have a hierarchy of controls here. Our first in our hierarchy is engineering controls. Here we're focusing on engineering the workplace to get rid of hazards. So we're very much focused, oops, sorry, I haven't flicked through the slides carefully enough. Okay, so here we're looking at engineering controls. It's our first point in our hierarchy. We're focused on the workplace, so things like the tools, the materials, the different pieces of machinery and equipment. What can we do with those to try and, number one, eliminate the hazard, or number two, reduce the hazard? So in terms of elimination, does that work process actually have to be done? Can we totally get rid of that exposure? If we can't, how can we reduce the exposure by using engineering controls? We'll talk a bit more about the various types of controls in the next slide. The second point on the hierarchy is the managerial controls. So that's about managing the workers and the work. So we're very much focused on the work design, the procedures and the various practices. Here we want to eliminate the hazard again, so does that work procedure have to occur, for example? If so, how can we reduce the exposure to the hazard? Okay, so in terms of our principles of prevention and control, our first principle and first in the hierarchy here is to control the exposure. Here, the first step is, can we eliminate or can we substitute this particular hazard? Do we have to use this particular hazardous chemical, for example? The next step is more technical safety measures, so engineering controls, things like isolating or enclosing a work process or a noisy piece of equipment, for example. Segregating, bringing in mechanical handling. Is it necessary that a human has to actually be having contact with this particular work process or these particular hazards? General or local ventilation. Can we improve the ventilation and extract fumes, for example, from a workplace? The next step is looking at organisational safety measures. Are there things about the way that we organise work that we can control the hazards? Can we put in special working methods around a particular process or a particular practice? Can we separate the production of the hazard in time or space? Can we move the process to another part of the factory? Can we do that process at a different time? Can we do it at a time when there's less people on the workshop floor so that fewer people are exposed? Can we reduce the exposure time? Can we speed the process up? Are there preventive maintenance programs like sweeping up dust that can reduce dust exposure? Are there pieces of personal protective equipment that we could use to reduce exposures? And what sort of surveillance can we do and an accident investigation to help re-inform these, our review of known hazards and controlling those hazards? Next is controlling human conduct. Here we want to give people knowledge of hazards so that they have knowledge of the hazards that they're working with, and they can think about their own behaviours and the way they interact with those. So things like education, training and job experience is quite important there in terms of imparting increased knowledge about those hazards. And then another way that we can conduct human control is the opportunity to act safely. Here we bring in legislation and company health and safety policies to direct people into the sorts of concerns they should be considering. The third point is the will to act safely. So this is mainly around our social and cultural factors. We know that risks will increase if safe conduct that the risk will decrease, I should say. Well, no, increase. No, that's quite right. Risks will increase if safe conduct is really difficult to do or is time consuming. So we need to make a lot of these processes as passive as possible. That's why engineering out hazards is a really good way of putting in passive injury and safety measures. Another key here is positive support for a safety program and for safety policies, and that needs to come from management, from supervisors and from the surroundings. So the surroundings in terms of the legislative support as well as workmates. People have to buy into a safety culture to engage with it. Okay, in terms of pulling this all together and bringing in safety management systems, there's different approaches that can be taken. At the workplace level, approaches can be varied. We see things like employers making a very public commitment to safety management practices and bringing it up to the top of the issues that they would manage every day in an everyday context. We see things like planning and review and evaluation, regular processes of hazard identification and assessment and management of those, information and training and supervision. Things such as employee participation in health and safety management is really great in terms of integrating the employee in with the worker, in with the employer and generating more emphasis around health and safety management, emergency planning and readiness. Also undertaking protection of employees that are on site that are actually not necessarily directly employed, things like contractors and subcontractors. From a population perspective, the way we manage occupational health and safety issues is a little different. We rely really heavily on legislation and standards and guidelines that are put into the workplace to control nasty exposures. We also rely really heavily on inspection and enforcement of these standards and guidelines and of the legislation. We also bring in national initiatives and national programs, one of which I'll talk about when I talk about the agriculture example. So in areas in which we have a really broad-based population problem with a particular health and safety concern, we can bring in national level programs to try and get more effort in terms of managing those issues. And occupational health and safety surveillance is really key to understanding what's happening in terms of the population. So I'm not going to talk about many of those aspects. I'm just going to talk about the surveillance because you're going to get another lecture about the legislation from another person in this session. So in terms of the population-based occupational health and safety surveillance, there's two arms here. There's the hazard exposure surveillance and the injury and disease surveillance. So the purpose of population surveillance is kind of similar, but they do have quite different focuses. Hazard surveillance is really lead time surveillance. So this is about identifying those hazards early on and putting in effective control strategies up front so that we prevent disease and injury from occurring later in time. Here we want to determine the magnitude and distribution and the different trends in hazard exposure over time, and we want to target our interventions to reduce those exposures. In terms of injury and disease surveillance, this is known as lag surveillance, so this is really the ambulance at the bottom of the cliff. Disease and injury has already occurred. Here we're wanting to identify potential causative exposures. We want to again look at the magnitude and distribution and trends in those different outcomes. We want to use that to help us target interventions to reduce future cases and also sometimes to monitor what sort of additional healthcare services we might need if we have big groups coming through who have exposures to these types of outcomes. We also want to evaluate the effectiveness of existing interventions, and this type of surveillance can tell us when we have some of those failures occurring or when interventions are really beneficial. So in terms of New Zealand population, occupational health and surveillance, it's quite ad hoc. It's undertaken by a number of different agencies, and it's not the most robust and rigorous surveillance system, but it's essentially what we've got at the moment. In terms of hazard surveillance, which I think is actually the most important form of surveillance, because it's about preventing exposure to these hazards and preventing future injury and disease, we have only two real forms of hazard surveillance here. We have our National Asbestos Register, and really this register is just surveillance of outcome. It's not really looking at exposure to asbestos hazards. And we have our Household Labour Force Survey that gives us a few economic and social factors that we monitor. So we have a really poor record in terms of hazard surveillance. In terms of injury surveillance, our main systems here are provided by WorkSafe New Zealand, which looks at notifiable occupational diseases and serious injuries, and ACC, which looks at the compensated occupational injury claims and the disease claims as well. They're our main forms, and that's supplemented by some hazardous substance exposure monitoring and some cancer registry data as well. Okay, so let's just move on to the example of agriculture. Agriculture is one of our most hazardous industries in New Zealand. A really large burden of occupational fatal and serious non-fatal injuries occurs within this sector. While other industries have seen declining numbers of fatalities and serious injuries over time, this hasn't occurred within the agricultural sector, and that's for a number of reasons. We have a really high burden of occupational health and safety concerns in agriculture. Injury is quite prevalent in this group. We see about 20 deaths a year in direct deaths related to workers in agriculture. There are a significant number of bystander deaths as well, but they're not included in this. We see about 2,100 serious injuries, so 2,100 incidences of people going to hospital and needing to stay there for at least 5 days. 21,000 injury claims overall, costing about 26 million in just the ACC claims. So that's just costs in terms of rehabilitation, lost earnings and medical expenses. Really common health concerns in farmers include things like chemical-related conditions, hearing loss, musculoskeletal disorders and pain, skin conditions from the use of, mainly from the use of agri-chemicals, vibration-related disorders from the use of hand tools, stress and suicide. You may have noticed that there's been increasing reports about stress levels in farmers and increasing rates of suicide. Although we don't have really good figures on this, anecdotally it seems that stress levels are rising in agriculture for various reasons. And fatigue, they tend to work long hours when they have to get a task done. They work at it for a long period of time and can get quite fatigued. There's also many different types of hazards. A farmer is known as a jack of all trades and a master of none. You need to be able to do a lot of different tasks over time, and you may not necessarily have a full set of skills to be able to do them safely, but you know how to do them, so you'll do them because a task needs to be done. In this photo we've got all sorts of different hazards here: mechanical hazards, animal related hazards, ergonomic hazards. So there's a wide range of different hazards, and the exposure to those hazards may be intermittent, they may be seasonal. We also have a large number of bystanders, which I alluded to before, on farms, in particular children, and children are at really great risk of injury and serious non-fatal injury in the farm setting. The farm is actually a workplace, but to a child it's also a recreational area, and children play in farm buildings quite often and will play out in paddocks. So we have this contamination and crossover here between play and work, and that can result in children being exposed to a lot of workplace exposures. Also, childcare is extremely difficult to come by in rural communities, and quite often children are taken out to work with their parents as a form of childcare. Also, family farm work is quite a strong tradition in New Zealand, and children are actually introduced to farm tasks very early in their life. And they may not necessarily have the physical or even the cognitive capability to do those tasks. And that makes them quite vulnerable. Overall, they're quite a vulnerable population. Also, they're very small in stature, and sometimes they're often using pieces of equipment such as a quad bike that's actually designed for a much bigger person, an adult, to operate. So it makes them particularly vulnerable. Other risks here to children are cancer risks and asthma risks from various chemical exposure and dust exposure within the farm setting. So in terms of controlling occupational health and safety concerns on the farm, we have our traditional methods in which we put the legislation into the setting, and we ask farmers to go out and make a farm safety plan to identify the hazards and to control them. Unfortunately, a lot of farming operations are family operations or very small operations, and they may not have the resources to be able to do that properly. Therefore, we've had some national initiatives undertaken by WorkSafe and ACC and the Lincoln University. The first one here, the Safer Farms, is a recent initiative from WorkSafe New Zealand and ACC, and it's about providing information to allow farmers to be able to make a health and safety plan, to identify their hazards and control them. It provides a few resources and helps them step through how to make a plan. The bottom website, the FarmSafe website, this was initiated by ACC, but ACC has since pulled out funding from this. It is now owned by Lincoln University, and this is a series of training programs in farm safety awareness, making farm safety plans, and in gaining farm safe skills that people would enrol in, and they would go through the whole course and come up with their own farm safety plan, be more aware about the different hazards that there are on the farm and how they can modify those and reduce the risks, and giving people all sorts of different skills like how to handle agricultural chemicals safely and how to operate a quad bike safely. Because in general, a lot of people in these communities have never had training in these things. Another way that we operationalise trying to get farmers to make changes and behave more safely is in the provision of safety guidelines, and these are called good practice guidelines. These are not compulsory, but they are a clear statement of what actions FarmSafe considers to be practical to ensuring safety. This particular one outlines the legislated obligations of farmers, the ways in which they could actually eliminate the hazard. Do they actually have to use their quad bike for whatever task it is they're doing? How they can ensure that the quad bike is right for the task that they want to do, and how they can manage very specific quad bike related hazards. So this is one way in which we can try and get some control and impart advice to a group that's particularly problematic and has difficulties in trying to implement health and safety management. Okay, so just to finish up, the key messages from this presentation are that workplaces are unique environmental settings. There can be a lot of long-term hazards. There is a diverse range of hazards, and there can be some quite high-level and low-level exposures. Workplace control and environmental control definitely overlap, and if you can get control of workplace hazards, then you've taken that first step to thinking about control of the broader environmental health concerns generated by work. Hazard assessment is a really key prevention activity in workplaces, and our prevention strategies are hierarchical. The higher up the hierarchy you go, the more likely you are to put in passive interventions that will be more effective at preventing on future injury and disease. And there are quite varied approaches taken at the workplace and population levels. Okay, so just to finish, I've just put my contact details up here. I'm quite happy for people to contact me if you have an interest in this, if you want to do some research in this area. Obviously it's my area of research interest, and I'm happy to have further conversations with anyone. Thank you.